Welcome everyone to another wonderful episode here at Josh Podiatry. Happy holidays to all.
Happy New Year.
Happy New Year as well. Thank you, Caesar.
You're welcome.
We have a young patient who has presented to our office with an excruciatingly painful iceberg of a corn. It's a huge corn on the bottom of the left foot. It's been causing tremendous havoc. Like I've said it before, I think the videos sometimes don't do, justice to these clinical presentations. They really don't. But what we're going to go ahead and do is basically enucleate, just carve it all out down to the core. Let's get to work. Okay, so this is basically another clinical presentation. A little bit of fat pad atrophy. We have a pre-dislocation syndrome. The toe is basically dislocated outside of the joint. Basically, the metatarsal head is diving down, and that is the symptom, right, of the underlying problem. We already we marinated the corn, callus, call it whatever you guys want to call it, intractable porokeratoses. We have basically marinated the lesion with our Trisoft, okay? So let's get to work. We did offer the patient a little bit of local anesthesia, but the patient deferred. The patient did not want that. ¿Está bien, Mimi? So we'll take out the initial cap, the top cap. Lo único que no le pido es que no mueva el piececito. Okay? So I'd like to, in the elderly, because their skin is like porcelain, it's really important to do what I'm doing. It's like a little abyss crater. Again, the video doesn't, do justice. And yes, a lot of people will say this looks like Parmesan cheese, soap. We have a lot of crafty, unique minds out there. We still haven't. This is way deep. You guys are gonna see. Whew. Talk about pain relief. And again, if this is a symptom of the underlying structural deformity, so we're still working the periphery very carefully. I'd like to work the periphery more first because I know that we're going to eventually make it to the central portion. ¿Estás bien? You okay? ¿Está bien?
Estoy bien, gracias.
Okay, excelente. I asked the patient if she was okay.
Ya está terminando.
She's asking me if I'm almost done. Ya mismo, pronto. I said soon.
Gracias a Dios.
She's like, thank God. And you can definitely feel, see this is atrophy of the fat pad. Let's go like this again. Now I'm going to turn my blade like this. What I like to basically do, a lot of people do it different, Use an 11 blade, you use different types of blades. Looks like glass. And some people actually also apply just to try to excavate, right, more of this. They apply the beetle juice, the cantharone, that's intended for other clinical presentations. But we want to be also very mindful not to cause any harm because the skin is... It almost landed on Caesar's head. Again, there's something about these either nails or pieces of callous dead skin. They're just attracted to Caesar's head. Caesar's like the ghost. He's like Casper. Everyone wants to see who Caesar is. Estamos terminando ya. And I do like to leave this rim just for accommodation purposes. If she were numb, but again, just to be very clear with the public and the world, we did give her the option. And she said, no way, no injections for me. We would be able to go even deeper. But I'm trying to be very, very careful here. Let's see how much further down we can go. ¿Está bien?
Sí, señor, muy bien.
Excelente. I just asked her if she's okay. She said yes. We'll take a little bit more and that's it. There we go. Down to the bone, almost. And like I said, we're gonna leave this here. Very nice. ¿Cómo se siente?
Bien, gracias.
¿Mucho mejor?
Sí, señor. Ya está bien.
Let's put this down. So I asked her, how does it feel? She said, excellent. Okay, everyone, we're all done here. The procedure was a success. Patient will feel probably almost 100% better, no questions asked. For all of the non-subscribers, please subscribe to our channel. Make sure that your notifications are on. We will continue to do what we do, which is, again, at the core, we will continue to educate the world one foot and one toe at a time. And, we will, 2021 is going to be a great year for the channel. We have some really, really exciting and great things in the pike. And we, I know during the course of the last couple days, we haven't really had a chance to upload more consistent videos, but we do have a lot of wonderful things, wonderful clinical presentations that I think I think that the entire world will really appreciate as well. As always, happy holidays. What else, Caesar?
Happy New Year.
Happy New Year. Happy holidays to the entire world. And as always, let's stay safe. Thank you for watching.